This is Lexington, Kentucky, a normal morning. People going to work, going to class, going home. I used to drive these same streets. Before I was in college, I worked on an ambulance. I've been on these calls. I've worked these scenes. And I want to ask you something. How much can change in 1 second? This is what it looks like. Normal. Nothing about it feels dangerous. Nobody thinks something bad is going to happen until it does. And then it happens. 1 second. That's all it takes. In 1 second, everything changes. I've worked scenes like this. Too many to count. Every single one of them started this way. The call goes out. First responders are coming. Lights, sirens, everything moving fast. From the moment the call comes in, we knew this was bad. You get there and you work. You don't think, you just work. And the whole time you're thinking, somebody chose to look at their phone.
Let's go ahead and put a seat collar in place. Slightly diminished left side, but reactive. Is there any pain where I'm touching in your belly? No pain or rigidity. Arms intact. So we're gonna lift you up on 3. 1, 2, 3.
Hey friend, if you're in a bag for a wreck, you're just safe to get down to the hospital, okay? Just gonna get you good and secured, okay? We'll take care of you.
Male involved in a trauma in VA, hit and run, unwitnessed by pedestrians. Patient is showing a head injury underneath the pupils to the right side. Is radioactive, sluggish. Vitals are solid, blood pressure is 134/86, heart rate's at 82, sinus, SpO2. 98%. Unresponsive at this time. ETA about 2 minutes. Anything further?
Nobody's saying get rid of your phone. Putting it in the cup holder is realistic. Turning on Do Not Disturb is realistic. Pulling over if it can actually wait. That's realistic. The fix isn't complicated. It never was. This is what it comes down to. Numbers on a screen, a machine keeping somebody alive. I've sat in that room. I know what those numbers mean. I've held a stranger's hand, knowing there was nothing left to do.